Hello, my name is Bobby Shaw. This is my head-to-toe assessment for Spring Arbor University's Nursing 602. I have used hand sanitizer and washed my hands prior to me joining my patient. My medical assistant has taken the height, weight, vital signs, performed a visual acuity using the Snellen chart, hearing test, performing the Wren, Weber, and whisper test. No abnormalities were noted. Cranial nerve 2 is intact and cranial nerve 8 is intact. Now I'll greet my patient. Hello, Justin. What brings you in today?
A wellness exam.
Great. Well, thank you for coming in. Could you confirm your name and date of birth for me?
Justin Shaw, May 4th, 1990.
And today's date?
3/19/20.
Patient is alert and oriented. Cognition is intact. Well-groomed behaviors appropriate and cooperative. We'll start with inspection of the head, looking for symmetry, noting skin color, any lesions, and no abnormalities are noted. We'll palpate the head for any nodules, masses. Do you have any tenderness?
No.
Check the hair, the color, the distribution, noting any infestations, but here hair is clean, no infestations noted. We're going onto the eyes, looking for symmetry, looking for any drainage, swelling, redness. We will palpate your lacrimal ducts. No drainage is noted. Any tenderness?
No.
No. Close and open your eyes for me. Eyes close completely. Lashes curl out on top and lashes down on the bottom. I'm going to use my pen light to test the pupils. Pupils are 3 millimeters. I'm going to test direct and consensual constriction. Direct and consensual on both sides. Good. Pupils are equal, round, reactive to light, and then look at my pen light, follow it in, and accommodative. I'm also going to check the corneal light reflex, making sure that it is centered in the pupils and equal bilaterally. I'm going to have you cover one eye and uncover and over the other eye. Thank you. Looking for any eye wandering or jerky movements, and that is noted there. Test cranial nerves 3, 4, and 6, the extraocular muscles. I'm going to have you follow my finger with just your eyes. Using the H method. Cranial nerves 3, 4, and 6 are intact. I'll do the fundoscopic exam, looking in at the optic disc and vessels, noting any cupping, noting the coloring, should be creamy orange. Using my right eye to look at his right eye. First look for the red reflex, and then at the optic disc and vessels, there's no cupping and color is creamy orange. Switching and using my left eye for his left eye. Look straight ahead there for me. The red reflex and the optic disc and vessels. There's no cupping and color is creamy orange. Looking at the ears, noting any drainage or redness. Making sure that the pinna is in line with the outer canthus. Those are symmetric. Palpate. Do you have any tenderness or pain here?
No.
No nodules or masses noted in the ears. I'm going to check the inside of the ears, check the canal for patency. Pull the pinna up and back. Canal is pink. Tympanic membrane is pearly gray, and the cone of light is at 5. We'll check the left side. Look up and back. Canal is patent, pink. Tympanic membrane is pearly gray, and cone of light is at 7. We've already tested cranial nerve 8. That was intact. Move on to the nose, noting its midline on the face, symmetric, no drainage or obvious lesions or masses. I'll palpate. You have any tenderness?
Nope.
No tenderness or masses. Palpate your sinuses, frontal sinuses, maxillary. Any tenderness there?
No.
And no fullness noted on sinus palpation. We'll look inside the nose. First we'll check patency. Cover one side of your nostrils and breathe in. Good. And then the other side. Thank you. There's our patent. Going to be checking the inside for the mucous membranes. They should be pink and moist. Looking at the middle turbinates, making sure there's no swelling, and checking for septum deviation. And mucous membranes are pink and moist, no septum deviation, and middle turbinates are they're not swollen. Good. Thank you. Moving on to the lips, they're moving symmetrically. They are pink and dry. No obvious breath odor. Now I'm just going to have you kind of open your mouth. I'm going to look at your teeth. All teeth are intact. No dental caries. Can I see your gums? Gums are pink and moist. No redness, no bleeding, no lesions noted. And I'm going to check, open your mouth for me. I'll just check the inside here. Hard palate is fused. Soft palate is pink and moist. Tonsils, there's no enlargement, no exudate or tonsil stones noted. Tongue, there's no lesions. It's pink and moist. It protrudes midline. Stick it out farther. Go and say ah. Tongue protrudes midline. Cranial nerve 12 is intact. Has been articulating his words, so that's another sign that cranial nerve 12 is intact. Cranial nerve 9, I just tested the glossopharyngeal. Say ah. The uvula remains midline and rises up. Cranial nerve 9 is intact. Cranial nerve 10, we'll check your gag reflex. Gag reflex is intact. We see underneath your tongue. No lesions there. I think that is mouth. Oh, I did forget on the face, we're going to check temporal pulses. Those are +2, and then check the temporal mandibular jaw cranial nerve 9, the trigeminal. Palpate here at the masseter. Have you open and close your mouth. Good, and go side to side. Good, and feeling for any clicking or grinding. There's none noted there. Cranial nerve 5 is intact. Just cranial nerve 7. The facial nerve, looking for symmetry. You raise your eyebrows and smile. Puff out your cheeks. Good. Good. Cranial nerve 7 is intact. We'll move on to the neck, looking for the trachea, making sure it is midline, noting any, there's no obvious goiter or enlargement there, checking color is consistent throughout. And we'll check the for the JVD, jugular vein distension. There's none noted while he's sitting. Test the carotid pulses one at a time. Those are +2. Also listen for bruit. Take a breath in and hold it. Breath in and hold it. And there's no bruit noted. Also going to check your lymph nodes with preauricular, postauricular, occipital, down here to submandibular, submental, and on down to the deep clavicular. Any tenderness?
No.
There's no palpable lymph nodes. I'm also going to check the thyroid. I'm actually going to have you kind of turn to the side, put your legs on the other side if you can, or just turn a little bit downward so I get behind you. feel, palpate the thyroid, and I could ask him to take a drink of water here. I'm just going to have him swallow for me. Thank you. And there's no enlargement noted. I can feel that the thyroid does move up when swallowing. I'll test cranial nerve 11. I'll have you resist against me pushing down your shoulders. Good. And then resist against me pushing your face. Good. Cranial nerve 11, the accessory muscle nerve, is intact. Now I'm going to ask you to put your knees or legs on the other side of the table there. I'm going to test your posterior chest, and back here we're going to be looking for symmetry, noting respiratory rate, rhythm. There's no accessory muscle use. Assessing the AP chest diameter. It should be a 1 to 2 ratio. There's no barrel chest noted here. I'm going to auscultate your lung field. So when I place my stethoscope on your back, please take a breath in and out. Listening for any adventitious breath sounds, wheezing, and lungs are clear throughout all lung fields. We'll listen for vocal fremitus. I'm going to ask that you say 99 each time I place my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99. And the breath sounds should be muffled, and they are. Also do tactile fremitus. So when I place my hands on your back, say 99. 99, 99, 99, 99.
The vibrations are equal bilaterally, and the vibrations lessen as we go down the back. Also percuss all the lung fields. I should hear a resonant sound in all the lung fields. Resonant sounds heard throughout. Well, chest expansion. I'm going to place my hands here at the back and have you take in a deep breath. Good. Chest expands equally on both sides. I'll have you now turn back forwards here. We're also going to test the anterior chest and heart. Still noting rate, rhythm, use of accessory muscles. All of that looks normal. I can also palpate here the front lungs. And then listen to lung sounds on the anterior chest. When I place my stethoscope, just take a breath in and out. And again, noting any adventitious breath sounds or wheezing, as lung sounds are clear throughout all lung fields. Next, I'm going to listen to his heart, noting S1, S2. I'm going to listen with the diaphragm and then the bell, noting any extra heart sounds like S3, S4, or any murmurs. Have you said it straight? And this is going to be in the ape to man positions. bell. And then at the PMI, I can listen for a full minute. Here we're just gonna verbalize that we listen for a full minute and try to palpate the PMI. It is slightly palpable. It can often be more palpable once we lay him down and or turn to his left side. So now we're going to have you lay back. I'm going to lay flat. We're going to look here for the jugular vein distension. We could measure the jugular vein distension, but it is not present while he is lying down. I'm going to listen to those same heart sounds using the diaphragm and the bell in the ape to man positions. It's oftentimes easier to hear for extra heart sounds or murmurs while they're laying down. And then with the bell. And then I will feel for the PMI. And that can be easily felt here while he's lying down. I'm also going to listen to, or now move on to the abdomen. And here we can note for any symmetry. Abdomen is round, it does appear to be symmetric, no visible masses, and no visible peristaltic waves. The abdomen, we do start with auscultation, all four quadrants. Listening for vowel sounds. Vowel sounds are active. You could listen if he has hyperactive or hypoactive vowel sounds. I'm also going to turn this to the bell side. I'm going to listen for any bruits at the aorta. Sorry, hold your breath for me. The renal arteries. Iliac arteries. And we also listen at the femoral arteries. Thank you, you can read. There's no bruits noted. Auscultate, then we can palpate all four quadrants. Start with light palpation, noting any tenderness. Watch their face for any grimacing. There's no masses noted. I'm going to do a deeper palpation. Again, looking at their face for any grimacing or pain. Do you have any pain?
No.
We'll check rebound tenderness. Do you press in and let go quickly? Any pain?
No.
Does it radiate to the other side?
No.
No. Check the other side as well. And then we can check the McBurney's point, which is 2/3 of the way between the iliac crest and the umbilicus. Any pain there?
No.
No. That would check for appendicitis here in this right lower quadrant. I'm going to percuss all four quadrants. When percussing the abdomen, we should hear a tympanic sound. And there's tympany heard throughout the abdomen. For the liver, we'll percuss at the liver. Here at the mid-clavicular line, starting at the umbilicus, I'll palpate up, noting where it becomes dull. We'll mark that spot there. And starting here at the nipple line, palpating or percussing down, noting where it changes to dull. And this here would be the liver border, and I'd say his is probably about 6 centimeters. I will palpate for the the liver using the hooking method. I'll have you take a breath in and out. When he breathes in, I can feel the liver border, or palpate the liver border when he takes a deep breath in. The spleen, we'll percuss the spleen, go here to the 12th intercostal, go up to the 10th space, and percuss. We should have a dull sound over the spleen. I'll try to palpate for the spleen. Take a deep breath in and out. And the spleen is not palpable. That's a good sign. If I was able to palpate the spleen, that would be a sign of enlargement. Moving on here to the hips while I have him laying in this position. Oh, sorry, before we do that, I'm going to try to palpate for the kidneys as well. So hand underneath. The kidney is not palpable. And non-palpable on that side. Hips, palpate the hips. Any tenderness here?
No.
No. I will have you test range of motion. Pull your knee to your chest. Good, and rotate your knee. Internal rotation, external rotation, and extension. Range of motion is intact on the left side. We'll do the same thing on the right side here. Take your knee to your chest. And then we'll do internal and external and extension. Range of motion is intact. And still, while I have you here in this lying position, I'm going to feel for your femoral pulses. Femoral pulses are a +2. I'm going to have you rise up and come sit at the edge of the table here. I'm going to go on to your upper extremities, noting symmetry on both sides. Skin color is consistent throughout, looking for any lesions, redness, swelling. Palpate the acromion process down to the elbows, the wrists, looking at the finger joints, noting any nodules, checking cap refill, what's 3+, and skin turgor, what's good and elastic. Also checking the left side here, the acromion process, elbow, wrists, fingers, nodules, cap refill. Did you have any pain in any of your joints?
No.
We'll test range of motion. I'll ask you to put your hands overhead, extend them back as far as you can, then down to the side, down by your side and back behind. Good. Range of motion is intact. Check elbows, flex and extend for me, and wrists, flex and extend, and fingers, abduct and abduct. Good. Range of motion is intact. Also test your pulses. First I'm going to test your brachial pulses. +2. Radial pulses are +2. Check grip strength and ask you to squeeze my fingers. Good. Grip strength is 5 and equal bilaterally. And then test your deep tendon reflexes. Just relax your arm here for me. Test the tricep reflex, the bicep, and the brachial radialis. It's usually 1 to 2 inches up from the wrist. We'll check the other side. Relax your arm here for me. The tricep. Bicep. And again, the brachial radialis. Good. Reflexes are intact. Moving on to the lower extremities, looking for symmetry, color, any edema, noting hair growth. It looks to be, the color is consistent throughout, there's no swelling, palpate the joints, the knees, ankles, feet. Do you have any tenderness?
No.
And I will assess your pulses, popliteal. Posttibial. And pedal. Popliteal pulses are +1 and posttibial and pedal pulses are +2 and equal bilaterally. We'll test your range of motion if you can flex and extend at the knees and at the ankles, up and down, and toes. Can you squeeze out and in? Good. Range of motion's intact, and we will test your deep tendon reflexes, your patellar, and then Achilles. And Achilles. Deep tendon reflexes are intact. We'll do dystaxia. Take your heel, place it on your shin, and take it down your shin. Good. And then on the other side, dystaxia is intact. To test neurological test as the extero now I'm at a loss for words of what it's called. But we can have him close his eyes, place an object in his hands and ask him to, an object such as like a key or paperclip, and ask him to identify it. Proprioceptive, have him close his eyes, and we can take a finger or a toe and ask him whether we moved it up or down. The cortical sensations, we would, Stereognosis is the one where we have him close his eyes and place an object such as key or paperclip. The exteroceptive is superficial pain and temperature. So we could take something like such as a cotton ball and or a toothpick and seeing if he can feel the difference between soft and sharp, and or temperature, something that is hot and cold. That's exteroceptive. We discussed proprioceptive, the cortical sensations, the stereognosis was the object. Graphesthesia would be having him close his eyes and drawing a number or letter on his hand and having him identify it. Then we have 2-point extinction. You can take a toothpick, break it in two, and ask the patient to close their eyes and see if they can identify whether you're touching them with 1 point or 2 points. And then the test for extinction, their eyes would be closed and asking them whether you touch them on the right side, left side, or both sides. Now I'm going to ask you to walk for me. So I'm going to have you stand and walk towards the doors back there for me. I'm noting his his posture, his balance, any pronation of feet or ankles, checking his gait, arm strength, posture. Go back down there. Come back walking on your tippy toes. Thank you, and then turn around and walk on your heels back towards the door. And then when you turn around, come back and go heel to toe for me. Good. And then let's see, come see if you can stand right here. So his posture was erect, his gait was well balanced, no abnormalities noted there, and no difficulties with pronation. We'll do the Romberg test. This is going to test for any drift or swaying. I'm going to ask that you put your arms straight out in front of you and close your eyes. And I will stand by for safety We could measure this for 30 seconds, but we can also see right here that there's no drift or sway. Thank you. I'm going to have you turn to the side. Let's see if we can see this, or chest the spine. Noting for symmetry, straightness, any curvature, any abnormal masses. Raise your arms up above your head, please. You can kind of palpate the spine and the muscles, noting any abnormalities or masses. I'm going to have you bend over and touch your toes as far as you can, noting for any curvature in the spine. And again, we can palpate down the spine and the muscles there, noting for any abnormalities. You can stand back up. I'll test range of motion. Have you do lateral bends down one side and then the other. Good. And then rotation without turning its hips. Perfect. Good. Range of motion is intact. And let me just think if there's any, actually I believe that concludes my testing. Thank you.